All right. So thank you so much, everyone, for joining us today. While we wait for people to join, I might just welcome everyone for on today's session. This is our second online forum, diversity forum, as we like to call it. And today we'll be talking about communicating with refugees, the what, when, and how. To begin with, I would like to acknowledge and pay my respect to the elders past and present, to those who have passed before us, and to the members of the Aboriginal and Torres Strait Islander community who are also attending here today. I want to acknowledge the traditional custodians of the lands we're meeting on here today. Thank you. Right. So I'm pleased to introduce our agenda for this event. We will start with our welcoming message from our team at Polaron, followed by a panel discussion. That's why we're here today. And then that will be followed by some questions to our panelists from all of you. And we'll be finishing with a summary of what we have discussed and a few steps we want to follow afterwards. Just a couple of reminders for us. This webinar is being recorded and it will be available for all of you after the event finishes. I'll be happy to send you an email where you'll be able to watch the video afterwards, and it will also be available on our YouTube channel. I might also say that this webinar is being live streamed on our YouTube channel at the moment. So if you know anyone who can't join on our Zoom webinar, they can also watch it on YouTube at this very moment. As we want to keep this webinar as much interactive as we can, we have enabled chat section for all of you. If you want to send questions to our panelists, or if you want to send a comment or any feedback, you're more than welcome to send it to us. We want to hear from you, obviously. And this is our wonderful panel for today. I want to introduce each of you, starting from left. So that's Marcus Masaki. Marcus heads the Language Service Department at Polaron and includes a team of project managers, translators, and interpreters in over 100 languages. Marcus works in partnership with organizations, culturally diverse communities, and the language services industry to deliver high-quality multilingual projects that are culturally and linguistically appropriate. Dina Yako is a refugee advocate who uses her personal experience of surviving and thriving as a refugee in her work. She has been directly involved in refugee resettlement for more than 15 years, and she has been a co-founder of programs supporting refugee young people and their families. Dina is also the Director of Community Engagement at the Refugee Council of Australia. We also have Dr. Jean Lavak. He's a senior lecturer in translation and interpreting studies at Monash University. He's a certified and practicing professional interpreter and translator for Croatian, English, and also German. He has published widely in the fields of translation and interpreting studies, and also in the related disciplines of multilingualism and intercultural communication. Sadia Ali is a former refugee who has dedicated her life to the empowerment of local communities. She's a passionate community leader and is the founder of United Culture Support and Afghan Women's Volleyball Team. Sadia is the winner of the 2019 Casey Volunteer of the Year Award and a 2-time finalist of 7 News Young Achievers Award. And last but not least, we have Eva. Eva Hussein is the founder of Polaron and a former refugee as well. She began her career as an interpreter and translator in 1993. And today she's a recognized leader in multicultural communication, winning the Victoria Multicultural Commission's Refugee Award in 2021. Over the last 4 decades, Eva has made a tremendous voluntary contribution to the Polish and Jewish community in Australia and abroad. Thank you so much, all of you, for joining us. And now we'll hand it over to Eva, who will be our lovely moderator for today's panel discussion. Thank you. Over to you, Eva.
Thank you so much, Andrea. So look, there's a reason for which we got together today, and the reason is that I, having been a refugee, having come here without speaking English and all of that many, many years ago, it'll be soon 40. I often reflect on how much has changed since 1986 and what else we can do to communicate better. And I think there's a lot of appetite for this discussion. In that people want to do the right thing. So those that work with service providers, we're getting refugees into Australia all the time, and there's new refugees coming from Ukraine already. So I think just by the mere fact that we had over 200 people registered for this event, it shows you how much interest there is around communication. So really, I don't want to say too much more other than welcome everybody. And I can see that people are from Western Australia, from all over the place. So that's really quite amazing that we are here. And I think having this session online, as much as we are tired of Zooms and all of that, is really good too, because we've been able to gather people from different spaces in Australia and outside of Australia. So we are going to be talking about effective communication, and that's difficult. We know that there's no such thing as one solution for everybody. We do need to look at tailor-made solutions. coming out of COVID, we know that there have been some failures. We've excluded some communities, and we've learned a lot from the pandemic as well. Today, we want to cover best practice, or what we can all do to improve our practice. We have a lot of interpreters and translators joining us today. So I think it's true to say that everyone wants to do things better, including myself. So that the 18-year-old Eva that came here all those years ago can contribute to the conversation of all the 18-year-old Evas, or whatever the age of people that are coming today, so that we're not surprised, but yet another cohort of people, or like I know, for example, with Ukrainian refugees, there are real shortages of Ukrainian interpreters because it was unexpected. So, the crisis wasn't something we knew that was going to happen. The other thing I wanted to emphasize today, of course, is the importance of working with local interpreters and translators that are NAATI certified as much as possible. We've been supporting that for ever since the inception of Polaron, and that's something that we're truly committed to. I myself am still a practicing interpreter and translator, and it's really important to provide high quality language services, and that's something that we are good at and we want to promote. So I'm done. Welcome everyone, and thank you. Over to you, Marcus, I think.
All right, thanks so much, Eva. So I'm just briefly going to talk about some ways of engaging refugee communities and just give you an example just before we will move on to the panel discussion, which I'm sure our panelists will have a lot more to say on that. So a question that we get asked a lot is how we can actually engage refugee communities in a meaningful way, in a creative way. And there are a couple ways that we have been doing this, which is through what we call community approved translations, and our co-design process. So to put that into context a little bit, so we know that many refugees are coming from countries that have been decimated by war. Some communities have low literacy rates. They have vastly different preferences for how people consume information. Whether that is reading, listening, or watching a video. So when people come to us with a message, what we do through our co-design process is we engage community members and we work together to find the best medium to deliver this message. We tailor that message and we tailor that, those resources towards different communities so that the message can, work as intended and, lead to actual actionable results. So that means that in the co-design process, which we have been working with, several clients, we work with community members, with clients from the beginning to create the original message in English, to develop the resources, make sure that this have, culturally and linguistically appropriate message and images, and, and that we take into account all of the cultural nuances. Now, our community approved translations, they work in a similar way in that people usually come to us, they have a message already, and they have their resources and they want that translated into community language. And what we do is we engage community members to look at these resources and just make sure that, you know, the translation is actually culturally and linguistically appropriate, and that the message is clear, will be understood, and will be actually useful. And as I said before, actionable to the, you know, community members that and the people who will be looking at that. So if we can move on to the next slide, Andrea. Thank you. Now, so in this slide, I'll just give you an example of a project we work on with the New South Wales Multicultural Health Communication Service in partnership with New South Wales Refugee Health Service. So they had a challenge here, and they were having a large number of, and the challenge was that they were having a large number of missed appointments, you know, in a healthcare setting. So what they did was, and the target audience was obviously individuals with low English proficiency. And the solution to that, Andrew, if you go to the next slide. And the solution to that, so instead of simply translating a reminder or a note, you know, it was decided that the best course of action was to actually create an appointment reminder tool that would let health service providers translate appointment details into the client's language. So we have helped the translation of the tool into over 27 languages, I think, even more than that. And now health service providers, they can actually type in appointment details in English, and a form is generated automatically in language with all the appointment details in language. So, you know, that can be printed out and handed to the people that need it. And this is just one example of thinking like outside the box, you know, in a creative way that has helped improve health outcomes as people were missing appointments and, you know, they didn't know where to go. Yeah, this is just one example. I will pass it on back to Ava, and I'm sure our panelists will be able to discuss that into more detail as we go along. So thank you so much.
Thanks, Marcus. So again, just amplifying the message that Marcus presented, that it's not about translating everything for everybody and putting it on a website somewhere that people can't reach. You know, there are issues such as literacy rates, or, you know, people, especially as they arrive into a new country, they might not be familiar with the system. So whenever we speak, you know, to our clients or prospective clients, we try and look outside of that box to see if there's anything we could be doing to improve the outcomes. So in this particular case that Marcus showed us, it was about appointments being missed, and it's measurable. We can now say that thanks to this tool, this appointment making tool, people are attending appointments, they understand who they're seeing, what time, and that surely improves health outcomes of people. So, you know, we no longer do sort of as many straight translations of fact sheets or brochures, because, you know, simply people don't read it. You and I don't read it, right? We consume information in a different way. So what I'm going to do is just show you a few statistics, because some of you are very familiar with this, some of you might not be. So between March 2012 and March 2022, so this is 10 years, we've received just over 44,000 humanitarian settlers in Victoria. And this is data from Department of Home Affairs. I know that people come from different spaces and different lands, so these are just Victorian statistics. And the interesting thing about that is that most are Arabic speakers, so 15,000, but also Dari, Hazaragi, and Assyrian. In terms of Ukrainian refugees that are coming, I've already mentioned that briefly, but since February 25th of February, 6,000 visas have been issued for Ukrainians to come. It comes with a whole set of new problems that I won't get into today in terms of what visas they arrive on, etc. But these are the numbers that I wanted to share with you. All right, so I'm going to start with Dina, and we already know who she is, but I'll also mention that she is Assyrian and Arabic speaker, and she does have lived experience of all the stuff that we were talking about. And Dina, tell us what are, you know, some of the challenges that you have personally encountered, and also you are seeing, because you work professionally in this space now, when it comes to communicating with refugee cohorts. Would you give us a few examples of what works and maybe what doesn't work?
Absolutely. Thank you, Eva. Of course, what's really important, I guess, in terms of recognizing some of the issues that impact newly arrived refugees, maybe the start off with is the trauma that they bring with them when settling in a new country. In addition to the experiences that they bring with them, there are a lot of new things that they have to learn in a very short period of time. So when we look at a settlement, perhaps, we look at refugees settling in Australia, and because of the limited resources that we have, that we work with refugees, often there is a lot of information that needs to be shared with refugees in a very, very short period of time. So what happens usually, then people become really information resilient. And because they have been provided with so much information in a very short period of time, that information is almost non-existent in terms of people comprehending that information. So yes, you may be given a little card that tells you if you do need an interpreter, you can call this number and you can ask for a language specific interpreter that that can assist you, but that information definitely gets lost in that process, only because we're giving this period of time where people are expected to settle within this period of time. Given that information, information of you worrying about, housing, accessing education, having to meet the requirements that you need to meet, your income support and so forth, often what we find, the impacts then become really familiar and really obvious when it comes to people's health. And I know that Marcus mentioned something that was really, really important. And I want to just add a little bit in terms of health and what it means when people do have the barriers. So having, I think, language barriers specifically in the health setting can actually lead to miscommunication, right? And then what happens then is that if we use the healthcare system, obviously in this scenario, this could mean a misdiagnosis of issues or incorrect diagnosis, which then of course becomes an access and equity issue, and also an issue where the patient satisfaction is really reduced in relation to that service that they're being provided. So these are some of the issues that people encounter in terms of when they come to a new country. The other issue that I find, day in, day out is the actual, kind of relying on family members or extended family, friends that can support you in that process. And I think the issue there is that, what are we doing or what are we not doing in terms of making that information really easily accessible to clients of the refugee cohort that often leaves them in a position where they have to rely on family members and friends or neighbors to support them through that process. So I think these are really, really important kind of issues that we need to be kind of addressing and unpacking a little bit more.
Thank you, Gina. And I know that Jim's going to be talking about the importance of interpreters, credential interpreters and translators in a moment, but I just wanted to touch on something that you've said, and that is the risk and the onflow effect that not having the right information at the right time in the right way can have on people, because if your health's not good, nothing else is good, right? Would you agree?
Definitely.
Yeah. Okay, so I'll move on to Sadia, and just with the purpose of getting your point of view on this particular topic. So what are some of the challenges, and you're very hands-on within the community and also the region, which is pretty diverse. So City of Casey, this is southeast of Melbourne. What are you seeing?
Well, thank you so much, Eva, for having me and having such an important platform where we are acknowledging the challenges of the newly arrived and especially the refugee community. As Dina mentioned about some of very specific challenges that she has experienced and as firsthand, experience as working directly with the community and people coming from diverse backgrounds, especially seeking asylum and refuge in a new country. I've seen that one of the basic, or I would say that major challenge that they see is the technical and ambiguous messaging and unclear jargon within the system that we have. For example, settlement, communication regarding settlement, and policies and legal interaction. As someone who has got direct engagement with the community members, I receive numerous questions regarding because there is an overwhelming amount of communication being done in that short period of time, as Dina mentioned. People get lost and get overwhelmed by the communication being sent to them through various channels, from settlement, from employment, from social services, and that's what happens, is that leads to a ripple effect in a sense that affects not only their health, but also their overall well-being, in a sense that they would start committing such unintentional I would say that unintentional sort of issues that would make them in a bit of a involvement in legal issues, for example, like having a ticket and parking their car in a no parking area or zone just to attend their appointment, because they have not understood the signage yet. So having that understanding of technical terms used, I think that communication is very much important in every area when it comes to settlement. And also some of the emerging languages that we come across is the dialect, especially for let's take an example of Hazaragi. It's not a written language, it's a dialect, it's a spoken language, and words from words differ, and one meaning in one language differ. Especially the challenge comes when there is no alternative in English language. That's another issue.
Yeah.
One important issue that I want to bring to everybody's attention is use of acronyms and slangs here, which is very common in Australian society. We tend to shorten our sentences, shorten our words, and use that acronyms, which is extremely difficult to understand by the refugee community and someone who is newly arrived here in a new country. That's one thing. And then the accent. Sometimes not sometimes, it's always there that people, as a newly arrived, I was not able to express myself because could be the accent, could be the confidence that what I was trying to say, due to the trauma and the responsibilities and every pressure that I had, or we as refugees had, we were not able to express that in a meaningful way so that we could explain ourselves and explain our circumstances. Literacy, digital accessibility, and awareness regarding usage of those devices or tools is another major aspect that builds on the challenges on the top of every other thing.
Yeah, and Sadia, you painted a pretty complex picture, and I think one point on the back of what you've just said I wanted to make is that often people think that when refugees arrive in Australia, that's it, they're safe, done, but that's only the beginning of our work, where, as you said, they may not be familiar with certain concepts, they may not be familiar with certain systems or rules, or even words like carer or intake officer, that can be so confusing at the beginning. And you also spoke of this overwhelm, like people wanting to do the right thing and throwing information at people that they cannot simply absorb or digest because it's just too much, right?
Yep. Yes, definitely.
Okay, well, thank you for sharing your perspective. So we'll now move on to the next question, which is examples of what works and what hasn't worked. So Dina, have you seen a terrible example of what not to do in your space, in your time that you've been to Australia?
Definitely a few examples there, but I want to just kind of touch on some, things that have worked really well rather than not worked well. We've all addressed the challenges already, spoken about, the miscommunication, the information, being really overwhelming in terms of absorbing that information, being information resilient, lack of access to some of the support services. What I've seen, I want to use this one particular example that I never forget. There was an encounter that happened at one of the settlement services that I was part of, and there was a person who didn't speak, obviously, English, and was trying to communicate with the receptionist downstairs. And so they couldn't really kind of understand each other. And at the end, I was called in to come in and find out what was happening. And then at the end, this particular client said one thing to me that stuck with me forever. And I actually used that as an example when we trained our staff in how to deal with people that don't, refugees particularly, and people that don't speak English. And she said to me, could you kindly just let the lady know that I am actually not deaf, but I just don't speak English. So there's no need for that person to be
raise your voice. Yeah,
absolutely. So the voice. So this is an example that it always has stuck with me, because often, because of our, we're being really passionate and wanting to, explain something to somebody, it may come across as not culturally appropriate. And that's, something that I often use as well as an example. What has worked really well, I think, is the use of the local small grassroots organizations. I can't say this enough, and I will, I always say that we also need to understand and remember the contributions that small grassroots ethno-specific organizations play in their communities. I think what has happened and what we've seen happen is that because of mainstreaming funding streams going to bigger organizations, often these really small organizations that play a big role in people's resettlement and their communities have actually been left out from the conversation. And I think what we could really, really use and what we could do really well is re-engaging with those small specific organizations that do some fantastic work with their local communities. I think another platform that we haven't really tapped in and utilized really well is the Ethno Media. So ethnic radio, there are many, many great examples of these particular services that stepped in during the pandemic and did a lot of the work in educating their communities. I heard some great examples of some really small groups where they started up at WhatsApp, group, and we're actually sharing some really, really important information in relation to the pandemic. And those examples then became best practice in working with multilingual communities. So having to go back to grassroots organizations, engaging with specific communities that are really, really connected to their people that they see on a daily basis, their local people, whether it's, the local community center, the smaller group that meets at the church or at the mosque, or these, senior groups that meet once a week, twice a week, because they are the ones that primarily want to use the service. And in order for us to actually connect with communities, we have to keep that community in the center of all the work that we do.
Dina, I am so pleased that you've said all that, because we're out and about. I've been attending lots of face-to-face events, and it is one of the things that smaller groups or smaller community organizations keep saying, that in order to apply for funding, they need to go through bigger organizations or partnerships. And by the time the work gets to them, and it is expected that those smaller groups you spoke about, those grassroots organizations, will actually do the work, because they're the glue, right? They are, they're not resourced, they're not paid. All of that work is expected to be done on voluntary basis. So there's something not quite right with the system of how all of that flows on to the actual communities. Yeah.
I just want to make one more comment, if I may. I think what we intend to forget is that once refugees come from overseas, we intend to put them in this refugee basket and not take into consideration the knowledge, the expertise that they bring with them. Yeah. And I think we have to be aware of the knowledge, connections, and experiences of refugee diasporas in Australia that can actually make those changes, and that they are the most advocates, I think, for the need and providing that voice for people who are going through that similar experience. And I think otherwise, if we don't allow that process, if we don't allow that platform, then they actually don't have access to decision makers, and hence why they get left out and left out of that conversation that's really, really important and vital, and their voices have to be centered in decision making.
Yeah, and it's about empowerment as well, and you know, being respectful to the groups and actually understanding where they come from. I'm going to throw to Sadia in a moment, but I just wanted to ask Marcus as well, in terms of examples of some of the things we've been doing at Polaron. You know, I think it's fair to say that we do more videos, podcasts, so a lot more multimedia work. Would you just care to comment just briefly?
So Eva.
Yep.
Sorry, what was your question?
Okay, I'll say it again. So I was asking about types of work that we now do at Polaron that's more creative or more solution focused. So things like podcasts, videos, because we do a lot less of the straight translations that people are used to, yeah?
Oh, yes, absolutely. So I mean, in terms of different work that we've done, I mean, I can tell you, not really related to resources, but we do have worked together with clients that came to us that were working on, I think they were working on communications with the parents and guardians of refugees, where, you know, we actually work together in partnership with another organization to actually train interpreters, not only in doing the interpreting job itself, but actually training interpreters to take notes and conduct these focus groups, interviews with the refugees in language. So we have been doing that kind of work, which is, you know, it's a little bit more creative, it's a little bit different. You know, it's been a little bit of a challenge because, you know, most of the time when you engage interpreters, it's like, you know, okay, is this an interpreting job? So, you know, what it is, the topic, what's the date, and that's it. But what we have been doing is we have been going a step beyond that, so that when we do have, you know, work with refugees like this, the clients, government clients come to us, universities as well. We had the Refugee Trauma and Recovery Program. I think University of Sydney that we worked on as well. Yep. So we can engage with interpreters, we can train them in partnership with other stakeholders, and then they can take on that role of being more than just an interpreter and actually, you know, carrying out this interviews and conduct this focus groups in language. That has helped our clients a lot as well.
Yeah, and I know that Jim's going to have a lot to say about that, because that piece of work that Marcus was talking about is really quite different, and the interpreters would be wearing a very different hat in that sort of context. So we'll just ask Sadia if you could share some examples, I guess, of what works and what doesn't work in this space.
It's a very important question, Eva, about what works and what doesn't work. In my experience as a direct engagement with the community and interpreters, I have found some horrible circumstances where I would definitely not recommend that at all. It's about integrity and honesty when it comes to NAATI interpretations, or when you declare yourself as an interpreter. And, you know, ticking the box of speaking multiple languages while you are not authentically that, you know, that is not your language, and you raise your hand, you know, claiming that language doesn't work, has not worked at all. I remember in one of the situations when we had to consult the community regarding an important project, and their community's voice was very important, especially the lower proficiency, or people speaking not, you know, having non-English background. So the interpreter who had claimed that that person can understand and speak English, that language, was actually not the case. And we came up with, you know, the words being translated in a different meaning, and there had been a lot of chaos and criticism on the word being translated in, you know, that had a very, very uncultural, I would say, that very, disrespectful meaning that had, created a disturbance within the community. So this is why I would say that if, through this platform, if you are NATI accredited and if you call yourself as someone interpreter, there should be a mandatory, and you should be compliant about, what languages you can speak, and be authentic about that. Because just claiming about, such and such languages I can speak, speaking is a different thing, understanding is a different thing, but when you are authentic about a language that is your origin, that's a different one. And coming toward what works is, in my experience, what has worked, as Dina has mentioned about the grassroots associations, I would say recruitment of bicultural, bilingual workers have worked really well, because they speak the language, they have that grassroots connections with them, they have lived experience like them, they have all the cultural understanding, and they have the lens through which we can get connected to that specific target group or focused group. This is why it is very important to have that understanding and being mindful of who our audiences are and what are we trying to achieve and what are we trying to communicate with them.
Thank you, Sadia. Phew, luckily we have Jim here to save us, because we have touched on all kinds of things, interpreting and translating. So Jim, what I wanted to ask you, firstly, if you wanted to respond to any of the issues that have been raised, and it's nothing new. We know that there are the picture of how interpreting and translating works in Australia is complex, and some of the issues that Dina has raised and Sadia have raised are real. There's no question about that. But I know that in your academic work, being a teacher to future interpreters and translators, you've been trying to raise the bar. You also are yourself interpreter and translator practicing, as am I. Anything you wanted to add or say before we go to sharing of some of the research?
Thank you, Eva. That's the point that Sadia just made is a really good one. When Sadia was talking about the people that refugees work with need to understand where they're coming from, what their cultural background is, their linguistic repertoires, what their prior knowledge is. That's a really important attribute in the first place, to just know the profile of the people that you're working with. I worked with refugees a long time ago, 25 years ago, both in Europe as well as here. And I was familiar with the situation in the host country as well as the source country. And this is information that you really need to interpret well as well. So one of the things that you're doing as an interpreter is you need the familiarity, obviously, with the services that are being provided in Australia. And this is what we teach to our students as well, that it's not just a simple matter of transferring one sentence into another. If you're working with a settlement worker or a bicultural worker or a settlement, etc., you need to understand the Australian system of settlement. So you need to understand, how does the educational system work if they would need to put their children into school? Education for adults, the 510 hours, for the adult multicultural education program, if they need inoculations, if they have qualifications. As Dina said, many refugees come with attributes which are very, very positive and can contribute greatly to the Australian society and workplace, etc., previous qualifications. So you need to know what things like the Overseas Qualifications Unit are. So you need that background knowledge to be able to interpret well, because if you don't have that, it's very hard to often understand a settlement worker. Dina also talked about acronyms, etc. So that type of familiarity is really important, and that doesn't come overnight. Often I work with younger students, etc., and I really do emphasize this to them. They need to get out and about, and we get our students to go on placements, to be in lots of different contexts, legal, health, welfare, etc., so that they're exposed to this, so that they understand this, even if they're not refugees themselves. So those are the attributes that you would want an interpreter to have. As Sadia said in that bad example, one of the good things that we have been able to achieve in Australia, well, since 1977, when NAATI was established, was the recognition from the government that it's not good enough for people to be pulled aside and to be language brokers or mediators. Yeah. And we had a PhD student, Adolfo Gentile, who's the former president of FITS. Yes. He's known to many of you. He documented in the bad old days, there were police officers, there were doctors, there were lawyers writing to their politicians and saying, I can't communicate with the people that I need to communicate with. We need to have interpreters to be able to, for me to do my job. We do have a fortunate situation as an openness to understanding what the problems are. We've also had the readiness for the government to spend money in establishing NAATI, training institutions, professional associations. So we do have a good infrastructure that we can build on. And it is important, though, as Sadia said, that we do have people who work as interpreters to be qualified, to have the sufficient proficiency level in both languages that they're working, because we don't want stories, as Dina also brought up, of misdiagnosis. I've done also studies which have looked at length of stay in hospitals, where the provision of interpreting services where it's higher. Do you know what the outcomes are? The outcomes are a decreased level of stay in hospital and also lower readmission rates. And often readmission is due to misdiagnosis. So these are concrete examples of how an improvement and an increase in interpreting services transfers into a direct health outcome. Yeah. And it's important that we also have that type of data to point to, because that convinces not just people involved in settlement and refugee areas, but also health. That's a concrete health outcome that we can point to.
And it's no longer anecdotal. We can rely on this research, which I'll move on to in a moment, to make decisions about purchasing, about training, about supporting, everybody in this space. And of course, the picture of the interpreting and translating industry, if you like, is not that simple, because we know that around 70% of interpreters are women. We know that most of them are themselves from refugee and migrant background. We know that it's a highly pressured, very difficult job to do. But of course, Jim, through Monash and other institutions like RMIT and also NAATI themselves and also have been trying to raise the bar of what happens on the ground, because I think that a poor interpreting occasion can do a lot of damage to a situation that's already difficult. So it's really important to work with credential interpreters to understand the level of knowledge about a particular topic. But of course, we also know that everybody's in a rush, and often interpreting occasions happen at the last minute. So the interpreter hasn't been briefed, they haven't been debriefed. They might themselves come from a situation of trauma and, very, very complex picture. But Jim, is there any other research you could share with us? And we will send it later if it's available to all the participants around communicating with refugees.
Sure. Eva, so I'm part of a project. This is funded by the Department of Health, and this was looking at COVID-19 and messaging to vulnerable communities. There are 8 different groups. Some of them were deaf, some of them were aged care workers, etc. One of the groups was refugees and asylum seekers. And what we were interested to look at was the messaging getting out there about key things that the government wanted to convey? For example, how should you behave at social gatherings? What's your attitude towards a booster vaccine? Do you wear masks outdoors? Spending time with others that you don't live with who have got a cough? QR codes, all that kind of stuff. What we found pleasantly and happily was that the actual behaviors, reported behaviors from the refugee and asylum seekers was not much different from the other groups, and in fact from, let's say, mainstream groups. So that does say in the first place that the messaging, and this is locally, Eva, as well, this is specific to Victoria and Australia, that the messaging was getting through. What we also look at is what things do they rely on to change their behavior? is it enough that we have translated and interpreted materials? And it's interesting to look at the people's consumption of things and also how discoverable things are. You talked before about making sure that the translation materials are co-designed and appropriate to the communities. And that is one of the challenges that the government authorities have. Okay, we can get these materials and these messages translated and interpreted. We can have audio files. We can have a mixture of video and audio alongside text. But how do we know it reaches those people that we want this message to reach?
Yeah.
And one of the obstacles is to make sure that these resources and these messages are accessible without first having to have good English skills and good technology skills. And that's one of the challenges we have, because the discoverability is a challenge.
Yeah,
but to come back to the study on COVID, it was interesting that Sadia, I think, mentioned this as well, or Dina as well, by cultural workers. It was actually human. Well, it sounds obvious, but human or familial or social circle contact as well, which reinforced this. So if you can get more people receiving the message, etc., within people's social circles, that reinforces the message which they receive in the first place from, let's say, government or translated and interpreted materials.
Yeah, because there's social proof to that and endorsement by the community and understanding of the community. And I think, look, in my ideal world, interpreters would be seen as partners. They would come prepared, briefed, they would get debriefing. We know that the picture is not quite that yet, but we're working on it. And the other thing I wanted to mention, which is very annoying to me, both of us are former refugee translator, interpreter, but that we often throw money at a problem without really thinking how is it being used? What's the outcome? How do we measure this translation? Is it even worth doing? Have they already done it? Does it exist? Is it going to do the job? Can people read it? So it's a really, really complex picture. And I wish and I hope that for decision makers that actually allocate budgets, they will reflect on that and think, about not just ticking boxes, but thinking, okay, there's a community, there's real people that need this information in a particular way, not just, putting it on our website. And I think, Jim, you mentioned COVID, and I think one of the criticisms that I have is that's exactly what happened. And we were all in isolation, but refugee and migrant communities were further isolated, but not getting the information in the way that they could understand. So we have only a few more minutes left. And one more question. So if I can get Andrea to... Okay, Jim, this is to you, but also to everybody. What is the role with the interpreter working with refugees? How would you succinctly explain what is, firstly, their job, but also those that work with interpreters? How can we make the exchange of information better for everyone?
In an obvious sense, they're there to remove the language barrier. So whatever the settlement worker or whoever says or signs to the other person, they receive in exactly the same waveform without any omission or alterations, etc. So it's not changed. At the same time, the interpreter needs to use their cultural, social background knowledge about where the refugee asylum seeker is coming from. And often when you interpret, let's say you've got a term like bulk billing. Now, you often have to paraphrase this because an Australian speaker will understand what bulk billing means. When you interpret that, you might need 23 words to adequately transfer and to fully explain what that term means to the refugee that you're working with. So it is the preparedness to know that where are they coming from, because the refugees, they're making associations with what they know, and they've got a new system that they're getting familiar with. The interpreter needs to know where they're coming from in order to appropriately interpret that information fully to them, so that the refugee, after they've heard, bulk billing, they understand what it means in the same way that an English speaker would understand what that word means when they're working with someone.
Absolutely. That's an excellent point. It is about, again, I go back to the point of seeing interpreters as your partners. I particularly dislike the term use interpreter. You might be using interpreting services, but you're working with the interpreter respectfully. And look, Jim's going to be leaving us in about 5 minutes, so we are wrapping up. I can't believe that 50 minutes have already gone. It's been a very, very interesting discussion. So what I might get Andrea to do is facilitate a few questions. But Jim, can you tell us one thing we can all do better in this space as a summary? Yeah.
Which group are you referring to? Who with them about we?
So we have in the audience, we have interpreters, translators, service users, former refugees. Is there something in particular that we can do to improve communication with refugee cohorts?
In the first place, for those who are settlement workers, they usually know this, but to allocate enough time, a number of people talk about the rush thing, and interpreted interaction typically takes twice as long as a monolingual one. So factor in enough time. Eva, you mentioned briefing. Briefings are so important. Even if they take 2 or 3 minutes, it tells the interpreter who they're working with, what the purpose is, what to kind of expect in general terms, so that when they actually step in to work with them, they know what they're expecting. Also allow the interpreter to introduce themselves, so that the person that they're working with, often they don't know, who are you? What is an interpreter? I don't know. So the interpreter needs to say, okay, I'm Jim, I'm working with you as your interpreter, and my role is, I will transfer everything that the English speaker says and what you say back to them. I need to respect confidentiality. However, the aspect of trust is a big thing we often ignore, because often people are divulging really personal information, and they need to know that the interpreter that they're working with is not going to pass that information on to anyone. And we need to say this to people: everything that you say will stay here and be treated in confidence. Right. So those types of protocols are important for us to follow, both as practitioners, as interpreters, but also those who work with us, to know that these are important, and these need to be in place at the start of interactions.
Right, I think that's an excellent point, actually, Jim, and it took you, 20 seconds? We're not talking about anything more than just a briefing, because you're right, some people have never worked with interpreters. Dina, I'll go over to you. Anything, just one thing we could all do to improve communication with refugee, asylum seekers, immigrant people?
I think I would touch on responsibility and accountability. Okay, talking about responsibility, you're responsible to ensure that that message is conveyed in the best way that you can. And I'll use an example. I once, wanted to engage with an interpreter. I'm an Arabic speaker myself, but I actually used the Iraqi dialect. The client was from a different language, Arabic language specific, so the client was Egyptian. I asked for an interpreter. We got an Iraqi speaking interpreter, and that interpreter could not actually translate anything that was said in that particular dialect. So talking about responsibility and accountability, as an interpreter, you are responsible and accountable to ensure that the message is being delivered. And there is nothing wrong with saying that I'm sorry, I can't actually proceed with this particular interpreting session, solely because I don't understand this particular dialect. And I think Sadia is nodding because she agrees with me. The other thing I want to touch up on, it's also really, really important to remember that when refugees come to Australia, they have already faced an extreme case of discrimination and persecution based on their ethnicity, language, religion, nationality, and so forth. So they have already had, to an extent, a really bad experience with interpreters. And we often hear about stories that happen at the UNHCR offices, at the interviews when they're being conducted for, visa interviews and so forth, and people reporting issues with interpreters being provided that aren't doing the right thing and are not responsible or accountable. So it is really, really important for us to be painting a different picture in terms of working with interpreters in the Australian setting that is actually a safe and a really, really a safe practice.
That's right. And it might be as simple as explaining to people that our interpreters work this particular way and this is what's going to happen and everything's confidential. And, all of us raising the bar a little. Sadia, what's one thing we can all do?
Well, one thing is hard, but there's no one answer to the issues that we have discussed. However, I would say that interpreters play an important role. And as Jim and Dina mentioned, that interpreters should understand and acknowledge and come with being authentic and understand that newly arrived refugees have rich experiences and important issues that can help community and government understand how the best services they need based on they should acknowledge the level of requirement and the need that they're looking for. And it is important to understand how to engage with them to set a safe standard and trustworthy relations. So this is very important for interpreters to build that relationship and ensure engagements are developed with person-centered, unique methods of support, the diverse experience of the people.
Amazing. So I'm going to have to say goodbye to Jim on behalf of everyone, because believe it or not, he's a teacher and he has to run to another campus. Jim, thank you very much for joining us. We'll send you the last 5-minute recording later, but I think your perspective has been very invaluable. So thanks for joining us today.
Pleasure. Thank you very much for the invitation, Eva, and it's great to be on the panel with the co-panelists. Thank you again, and enjoy the rest of your day. Thank you.
Okay, thank you so much. So before we move on to questions, I wanted to also ask Marcus, what's one thing we can all do to improve communication with refugee and asylum seekers, apart from working with Polaron, of course, every time?
Eva, so yes, I just want to answer this question in a slightly different way. So in my opinion, it's an anecdotal evidence, but sometimes I find it can be very difficult to find interpreters and translators that are working in the industry on a full-time basis. I think that just, is the nature of the industry, but I think we have to continue to push people that are involved in industry to continue to train interpreters and translators, especially in rare language. So we need to make sure that, we have a sustainable industry, right? Because if we don't have a sustainable industry, it's going to be very difficult for us to find interpreters and translators that are willing to even participate in training, right? Because they're not doing that on a full-time basis. So I think that we just need to make sure that we, we get involved in the industry and we talk to people that are involved, so we can, push for funding, for training, for interpreters and translators, and make sure that the industry is sustainable, so that translators and interpreters can actually work on a full-time basis. And that will make, I think that will be easier for everyone.
That's a great point. And we are seeing a lot of work being sent overseas, for example, where people don't really understand the Australian context. So it's important to know who your language professionals are. So it's not just a, transaction and people are sort of parachuted and hop out. And, it's about training, it's about support, it's about all of that. Thank you, Marcus. Andrea, we have about 3 minutes for questions, so we can probably only do one. I'm so sorry, but it was such an interesting discussion. Over to you, Andrea.
Thank you. So we have a question from Sue Park. He said, we work with the Afghan refugee cohort, and a number of our participants are considering interpreting through NAATI. On your point about familiarity with the services, how can we support new arrivals to understand the Australian system as they undertake interpreting as a pathway into employment?
Okay, so Sadia first, and then Dina, and then I think we're going to have to say goodbye.
Yeah, to briefly answer that, it is important to acknowledge that when you say Afghan refugee, it's a huge lens towards Afghan community. You have to understand that Afghan community is a diaspora of many ethnic groups within that. So it is important to understand which ethnic group or the tribe or the community you're talking about, or you're trying to assist in terms of Australian system assistance and provision of information. Once that is done, it is it becomes easier for the service provider to hunt for the NAATI accredited interpreter in terms of Hazaragi, Dari, Pashto, or any other language that's there. So it is first of all acknowledging which ethnic group and what language is important, and if there is a dialect, it is important to involve a bicultural or bilingual worker within that.
Amazing. Dina, you have 1 minute, go.
Okay, I think what Marcus touched on about the future generations of interpreters, it's really, really important that we tap into the younger generations. There is a large cohort of young people who are currently at schools who are being pushed through to do a hairdresser's course or a barista course, where I know that some of those young people speak 4 languages fluently. What hasn't been done in this sector of resettlement is actually the promotion of really viable jobs in the interpreting and translation field. I think that there can be a lot of work being provided with settlement services, partnerships with organizations that could really take the future of interpreters and tap into the great talent that we currently have that's really untapped into. And remember that these young people also bring extensive knowledge and they bring extensive experience in being interpreters in some part of their lives as well. So I think there is a gap at the moment in recruitment and training people in this sector. So I think that by really establishing some really good networks with smaller grassroots organizations, local schools, language schools we haven't even tapped into and spoken about, they actually hold the really great number of young people who are really fluent in their languages. So I think these partnerships could really address the issue of recruitment in the future for interpreters and translators.
Dina, I'm incredibly indebted to you for being here today, to Sadia, to Marcus and Andrea and Jim, who's now gone. But I will just say one thing on the back of what you've just said, and that is that Australia is really well placed to be the hub of interpreting, translating, language services. And we haven't really quite tapped into it because it's seen as a hindrance sometimes. So, I've seen in a document somewhere, interpreter was misspelled as interrupter. I think that's an excellent point. And in fact, we are running a session on the 7th of June, if anyone's interested, with the Gordon Institute and City of Wynnum, where there is scope and opportunity for people to follow that pathway, but it needs to be, as Marcus says, sustainable and local. Like why not give people jobs here in Australia? And if you don't want to be a hairdresser, maybe with all your 4 languages that you speak, you could be translator, interpreter. And it's not just for the Australian market. You could be working for anybody, anywhere. That's the nature of the world we live today. But we have run out of time. So I just wanted to thank everybody that's attended, everybody that's presented, and we'll continue this conversation. I'm hopeful and I'm optimistic. So I know we've discussed a few things that aren't quite right in this space, but we're working on it. And happy Refugee Week, everyone. Thanks for coming.
Thank you for having us. Thank you.
Bye.